Greetings. My name is Aram Abbas, and I'm a student in Damascus University, Syria. Today, I'm going to talk about antibody-drug conjugates, ADCs, used in breast cancers. Today's presentation will cover some epidemiology, target therapy prior to ADCs, and the structure, development, and mechanism of action of antibody-drug conjugates. Starting with some epidemiology. Cancer is the second common cause of death worldwide, and breast cancer especially is the most common cancer overall. 20% of breast cancers overexpress human epidermal growth factor 2 HER2 receptor. This type of breast cancer usually has poor prognosis. Target therapy prior to ADCs was selective to known receptors like estrogen receptor, progesterone receptor, and HER2 receptor. But it was only about antibodies, so it wasn't that potent. An example is trastuzumab. Moving to the structure of the antibody-drug conjugate. Each ADC consists of 3 parts: an antibody, a linker, and the cytotoxic drug. The antibody is the selective part of this type of drugs. It binds selectively to the receptors, giving it the character of selectivity, giving it the character of being so potent with many less side effects. The linker is usually stable in the circulation, but it's easily cleavable in the cell. And the cytotoxic drug, for example, chemotherapy. The development of antibody-drug conjugates. There are mainly 3 generations of ADCs. The first generation used non-cleaved linker that made them less potent than the parent drug. The second generation started to use monoclonal antibodies, and that increased the selectivity. Third generation had site-specific conjugation and made them the most potent till now. About mechanism of action, there is 2 mechanisms of action. The first one is called the classical mode of action, in which the ADC gets inside the cell and then the linker is cleaved, putting the cytotoxic drug inside the cell and killing it. The second mechanism of action is called bystander killing effect, in which the linker is cleaved surround the cell. So the cytotoxic drug is surrounded to the other cells, making it a little bit stronger and more potent. Here is a list of some ADCs specific for HER2 receptors. Actually, their name may be a little bit hard. If you spell it a little bit quickly, it would seem like a rap song, maybe. Actually, it's the end of the day. A day was so informative for me personally. I wanted to highlight antibody-drug conjugates because for me, I believe they would be the future of the cancer treatment. Because unfortunately, nowadays, cancer patients are feared from the side effects of the chemotherapy more than the disease itself. And actually, I have a vision or a dream that one day cancer patients will no longer receive their diagnosis as declaration of death, but rather as a blessing, because deep inside they will know that this disease is curable, whatever type of cancer it is. And I believe that this dream is achievable because of all of the hard work of the scientists, researchers, and doctors all over the world. Thank you again for giving me this opportunity.